Okay, everybody, thank you so much for joining us this morning. We've got people from the Philippines. We've got people from England here. It's an international workshop on posture and home office ergonomics to help prevent neck pain and other injuries that Dr. Andrea and myself very commonly see in the office work population, or and right now that might be the home office working population. So I know that's different for everybody right now. So really what we're going to go over today is some tips and tricks to make sure that our body and our work setup are not fighting us a little bit, are not the cause for some pain that we might be having, and also go over some things that will show you the importance of specifically the neck and upper shoulder neck area. I like to call it the schneck. It's a very technical term, and how that can have effect on things downstream from that area that are kind of commonly missed in my opinion, and the research kind of supports that a little bit. So, but before we get going, let's introduce ourselves a little bit here. Dr. Andrea, please introduce yourself here and let everyone know who you are and what you're all about.
All right. Hi, everybody. I'm Dr. Andrea Smith. I am a chiropractor practicing out of Westbrook, Maine, which is a small little suburb in Portland, Maine. I graduated from Life University in 2017, and I'm now running Synaptic Chiropractic. We're a neurologically based chiropractic center. My real big passion is helping people deal with the stress response going on in their body and how that affects them on a neurological and musculoskeletal level, and helping work with them to correct that and maintain that, which is so important because a lot of the times we correct these issues and then they come back because we don't change anything in our lives or in our setups, such as our desk and our ergonomics. Sure. So that is my passion, and I'm so excited to be here for you guys.
Awesome. Thanks. And I'm really excited to be partnering with you on this, Dr. Andrea, because this is a passion of mine too. I'm Dr. Phil Finnemore. I own WorkFitME Mobile Physical Therapy. I'm a Southern Maine, sort of greater Portland area based mobile physical therapist. And I help hardworking Maine professionals to maximize their physical performance so they can live a happy, healthy, and wealthy life doing what they love with who they love. And my practice was actually born a little bit out of trying to help people in this work from home shift that we are in now prevent the types of things that we're talking about today. So as we jump right into it a little bit here, and actually before I jump into it, I got excited about this next stat I want to share with you guys. A few stats I want to share with you guys that I think are real important to talk about today. Before we get going, I want to hear from you all a little bit. So in the chat area, I'm sure you all know how to use the chat area of Zoom at this point. I want you to let us know whether you work from home or not. That's really not super important, but when you are working at your desk, are you working on a laptop or a desktop? Okay, that's the first question. And then if you are working from a laptop, I also want you to throw in there whether you use an external mouse and keyboard or not. Okay, so if your answer is laptop, you can just type in the chat laptop, yes and yes, or laptop and keyboard, or whatever combination of that it is. So I kind of want to get a lay of the land here a little bit with where everybody's at. So throw that in the chat for us here real quick. We'll take a minute or so to do this, and then we'll jump in. Desktop and keyboard. Okay, got some desktop so far. And we'll definitely go over why this is important, and we're talking about it.
Different ergonomics for different setups. So.
Exactly. Ooh, and we've got an iPad. Okay.
Ooh.
An iPad. All right. We'll talk about that.
That is your iPad. Oh, no mouse. Yes, a keyboard. Awesome.
Awesome. Okay. Good.
Very cool.
All right. Wonderful. Good. So a little variety, sometimes and sometimes also work off a mobile device. Okay, so a phone. Okay, good. So we'll go over some things for that too. All right, so kind of a good little mix of everything. Laptops, iPads, phones, desktops. Great, wonderful. And if you're all still working on that, don't be afraid to throw it in there as we kind of get talking a little bit here, because we're gonna go over some of this and why it's important. But yeah, Dr. Andrea mentioned it, is there are different things we need to key in on for all of those setups. There are certain things that kind of remain the same, but there are certain things we need to take into account, specifically to like an iPad, a laptop, even working on a phone. And good news is we already planned on talking about all those things. So great. wanted to get a lay of the land before we jump in here. So the big take home point that I love to give people during this discussion is the fact that everyone knows pretty basic ergonomics, right? I say everybody, that's not always true, but ergonomics is a pretty hot topic, right? I mean, especially if you work for a larger company, I'm sure you've probably had someone certified in ergonomics come and look at your workstation. Okay. So, and the workplace injury data shows us that is true. With an increased focus on ergonomics over the last 7 to 10 years, the rate of workplace injury has gone down pretty steadily. The problem with that is the reasons for the top reasons for people to continue to miss work and have workers' compensation cases are still very preventable causes, such as overuse and pain, sprains, strains, and tears, and just soreness and pain in general. Okay. So those are still 3 of the top 5 reasons. So even though our focus on ergonomics has shifted and is very at the center, especially in those bigger corporations that people might work for, we're still missing the boat a little bit here. Okay. So that's why we're going to talk a little bit about the posture and our body within that ergonomic setup, because if we don't address both things, we're only going to be hitting on maybe half of the problem. Okay. And I'm not even sure ergonomics is half of the problem. I think it might be a little less than that. I think most people probably have a pretty decent ergonomic setup for themselves. Because honestly, if you're not comfortable at your desk or something, you're going to change it. Right. I mean, that's a pretty, that seems pretty obvious. So, yeah, I really like to always talk about the combination of those two things. Okay. The ergonomic setup and the person within that setup, because if we don't have the two things, we're kind of missing the boat. Do you have anything else to add to that, Dr. Andrea?
Yeah, I would just say, you can have an ergonomic person, specialist come in and set you up and make sure everything is okay and go through it with you. And that's incredible and wonderful. And what a value it adds to your workspace. But if you're still not working within that ergonomic setup properly, then the same issues can still arise for you. So it's about how you're posturing within that ergonomic setup. If the stress levels are increasing and that's changing the tension in the neck, shoulders, mid-back area. So you could have a perfect ergonomic chair, but still be very stressed out, or still the eyes aren't in ergonomically set up. So you start leaning in, the shoulders come up because that stress response kicks in. Sure. And then your chair might be great, but it's not helping you at that point. So yeah, I would definitely agree. Ergonomics are the first thing to look at. And then we look at the body and its response to its surroundings.
100%. Yeah. And I think that's some of those things that you said are real important. It brings me to kind of the number 2 point, or really almost the 1B to this, because we talk so much about posture and ergonomics, but right next to it in line is the fact that there is no such thing as a perfect ergonomic setup or a perfect posture that you should be in all the time. Okay. Life requires us to have a variety of movement and put a big variety of different types of stresses through our body to do what we're doing on a daily basis. So if
the adaptability, I would say, the adaptability of the system.
Exactly. We have to be able to adapt to our surroundings and adapt to the things that our environment makes us do on a day-to-day basis just to live. So we can't be the Tin Man sitting in perfect straight posture at our desk with our head and neck and stacked over our shoulders and our shoulders stacked over our hips and our elbows at 90 degrees and our knees at 90 degrees and our feet flat on the surface that we're on. If we were like that all day, okay, yeah, sure, maybe our anatomy is a little more lined up. So in that position, we're probably not going to feel too bad. But you do that day in and day out for, let's say, 8 hours a day in your workspace, and then life asks you to do something out of that position. That is usually where the problem comes from. Okay. So that's also true if we have quote unquote poor posture, right? It might not be that having our shoulders rounded and our head forward, being in these types of positions, it might not be that those things alone are, and just being in that position a lot is actually causing the problem. It's when life inevitably asks us to move out of those positions and stresses our body in a different way, that our adaptations to that position are now causing a problem. Right now, there are certain things where being in that position for prolonged periods of time is probably going to lead to a problem. Okay. but it's not always the posture alone. It's usually the adaptations to our body in that position. And it's the lack of variety within that position that causes the bigger problem.
100%. I could not agree more.
Yeah. So that's my kind of our first takeaway for you all is, I like to say motion is lotion. Okay. Variety is the spice of life, right? Let's use a couple catchphrases here. Motion is lotion. Variety is the spice of life. So I tell people, and actually we're going to show you here in just a couple minutes, a checklist that you all can be using for some of that ergonomic setup. And then as we go through the rest of the workshop today, we're going to show you some ways to help move your body out of some sustained positions over time. But the number one thing I tell people, regardless of ergonomics, regardless of posture, regardless of stretching or exercise or anything like that, switching your positioning up during the day, even if it's just getting up every 30 minutes and moving around, 45 at the most, but 30 to 45 is a good time frame. Mm-hmm. That alone is going to make sure that we're having enough variety in our day. Because if any of you are like me, I've got a task I'm working on, I blink and it's 2 hours later and I'm done the task, but I haven't moved from my laptop for 2 hours. Okay. it's very,
usually your nose has gotten closer and closer,
right,
and closer to the
screen. you're exactly right.
Your shoulders have gotten higher and higher and rounded and rounded. And
exactly. Yeah. And we're putting a lot of uneven stress on some of those muscles and asking them to work to hold us up. Right. So that's part of what we're going to get into a little later, but we're putting a lot of uneven stress on some areas that then have to work to hold us up during that time, especially if we're not supported well by our chair. So yeah, variety is the number one thing. So Dr. Andrea, why don't we do this? Why don't we show them the checklist? Because I think that'd be a great way for us to we can just highlight a few of the things on it. I don't think we have to go through the whole thing, and we can actually throw the link to that in the chat so that if people want to download it, they can. But yeah, let's just go through a couple of these things and just give a little commentary, so to speak, on a few of these things. So where do you like to start with your folks when you go through this?
So I usually we start off, I like to just start off from the beginning, start with the office chair. Like, where are you at, number one, with the thing that you are sitting in right now? So this is a checklist, and like Dr. Phil said, we'll put a link to this in the chat room so that you can kind of have a self-assessment checklist to go through, and some suggested action steps to kind of correct that if it's not working well for you. So a couple of things, you guys, I'll go through a couple of points in each category. Does that sound good, Phil? Like, yeah. Just so we don't go through each and every thing.
Sure. Yeah.
The whole time.
Right.
So a couple of things. Can the height, seat and back of the chair be adjusted to achieve the posture that you see below in the picture? So do you have an adjustable chair, basically? Or are you sitting in more of a kitchen chair? Are you sitting at a stool at your kitchen top? Are you sitting in your car? Some people I know are doing there's a lot of Uber Eats, there's a lot of Instacart, there's a lot of delivery services where people they're work from home, it's their so can you adjust that chair to make it a little more comfortable for you, or do you need to adjust your workstation to meet your chair that you're dealing with right now? Because we can't always just get a brand new chair. I get it, they're expensive. So
sure. Yeah. I think
so that's go, Phil.
Oh, sorry. Yeah. I was just going to say, I think the biggest thing to take home from that too is the adjustment, right? Because another big question I get a lot is, about, oh, should I have a sit to stand workstation, or how do I go about using that? And if you don't have that, or don't have the ability to have that, I think they're a great option. I wish I could show you well, but there's no real easy way for me to show you. But I've got one that sits right on top of my desk that I can raise and lower to sit and stand. That's how I'm standing here right now. I think those are great for a work from home situation, or even in the office, because they're not that expensive. I think it's like $130, $150 or something like that, relatively inexpensive. But if that isn't possible for you for a variety of reasons, even just having the ability to have your chair up a little higher for a little while, and then a little lower, and then have your seat straight up for a little bit, and then have it recline back a little bit. Making those small adjustments to the chair or other things on your workstation can give you enough variety in your movement and the sustained stresses we're putting on the body during the day to make sure that we're keeping up with the amount of variety that we need in that situation.
Yep. I would say a big one for me, are your feet fully supported on the floor, or are they on a riser where you can rest your feet? So Phil, and you can chime in on this, but a lot of people that I see who are working from home are ending up tucking a leg up underneath their body, or their legs are crossed for an extended period of time. And when you do that, that changes your body mechanics. It changes how the muscles are posturing, because we all know the body is a fully connected unit. So we know that what goes on below is going to affect what goes on above. So can your feet be relaxed? Can they be down? And are you comfortable sitting like that? If you're not comfortable sitting with your feet fully in contact with some surface, then that's something else we should talk about. But for right now, for our purposes, just yes, having an adjustable chair, being able to put your feet down on the ground, no matter where you're at, just so you have that stability in your system, I think is really important.
Yeah, 100%. I would say that's one of the only things that I would suggest not wavering on, or really changing much, because going prolonged periods of time where just your toes are touching, or like sitting on one leg or crossing your legs or whatever the case might be, that over time doing that more repetitively can be it's going to affect a lot of things, literally from the hips and knees all the way up through your neck and your head. So that's one of those I hate to say non-negotiable, but it's one of those things where it's like that one is really important for the rest of it, but other things can be adjusted and fine-tuned a little bit more.
Yeah, I would agree. I think another thing for me, especially with a lot of people, I don't know for you guys, but a lot of people come up with carpal tunnel injuries being one in the top 5 of workplace injuries that happen. So again, checking in with your posture, but also your keyboard. Is your keyboard up on the risers? Are you at an elevated angle for an extended period of time all day long? Are your elbows, are you reaching out more to reach that keyboard, or are you tucked all the way in and shoulders up? So again, making sure your keyboard is flat in a neutral position. If you can have your elbows at 90 degrees, that's great. And for me, also having, depending on if you're on a laptop or a desktop, having at least an arm's length. So being able to take your arm and reach out and just barely touch your screen. So having that distance, again, that can change depending on vision changes, glasses, contacts, things like that. But a solid rule of thumb is to have that arm's length distance to reach to your computer, so that your eyes, either one, you're not sitting fully back trying to strain, or not trying to come fully forward.
Yeah. And I think another couple things to add to that. One, even if your keyboard is like mine doesn't have a adjustment to go higher or lower it, so it's already at a slight angle. So in that case, I really like suggesting the use of a gel pad to rest your wrist on, so you're not getting constant pressure there. The other thing and this actually goes back to the first question that we asked at the top, using a laptop versus using a desktop, or someone said iPad. Dr. Andrea just mentioned about an arm's length away for your computer. If you don't have an external mouse and keyboard for an iPad, excuse me, and for a laptop, if your computer screen's an arm lengths away, like mine is right now. I'm touching my screen right now. I'm an arm's length away. This is where my arms have to be to type. Okay. Like you're not going to sustain that for even for 30 minutes. Okay. So that's why it's super important to, and I know with the iPads, a lot of them come with a case that has the keyboard on it. It's better if you can get a external keyboard that's Bluetooth so that you could actually set the iPad up more at eye level and have a keyboard that's fully separate from the iPad, not directly attached to it. That way we can be in a more comfortable position for our neck and upper back and shoulders and for our arms. And that brings me to another point with carpal tunnel. I want to share this stat with you all because it's my favorite. It's scary, but it's also my favorite stat maybe ever in relation to this stuff. So in our most recent workplace injury data, the amount of days that people with carpal tunnel missed work with diagnosed carpal tunnel was 30. Okay. That was right in the middle. That was not the average, it's the median, but that was right in the middle. That is one less day than people who suffered an amputation at work. Okay. The reason why that is so surprising is because carpal tunnel is a nerve irritation, right? It really, in the grand scheme of things, is nowhere near as traumatic as losing a part of our body. But the other big thing is it's a couple things is it is preventable with doing some of the things we're going to go over today. It's very, very preventable. And number two, I think it's often a little overdiagnosed. Okay. And we'll get into this a little later, but when we have symptoms down in our hand, it doesn't just mean it's something in this area that's the problem. It could be all the way back up here. And if that isn't examined beyond a nerve conduction study, which, can be good, but can also miss a few things, I think, depending on how it's done and where it's done and when it's done, we're not correctly diagnosing that as carpal tunnel. So that's my carpal tunnel soapbox real quick. but I think it's important to note that, when we're talking about the keyboard and mouse with the laptop, they really have to be separate in order for us to not be putting too much stress through the system up through this area and our shoulders, especially down through into that carpal tunnel area. And that's why assessing our body and how our body works within this ergonomic system is super crucial for things like the development of a nerve irritation like carpal tunnel.
Yeah. I totally agree. Carpal tunnel is a subject we could go off on forever.
We could do a whole nother workshop on that, Dr. Andrea.
Oh, we're going to do that one. The next thing we want to talk about is one that I find very important is where is your head at in relation to your screen? So where are your eyes at in relation to your screen? Are you somebody that's looking all the way up to get to your screen? Are you somebody that's looking all the way down? So are you on your phone? Are you on a tablet and you're looking down constantly? Either one, more up or more down, is going to cause some issues. So what we like to recommend, and Phil, you can please chime in here, is we like you at a horizontal level. So you can kind of see with both Phil and I's computers, our heads are right in the middle of the screen. We're looking straight at you. I don't have to look up or look down to look at my camera. Which is a really good point. You can have it, I always say, I like slightly elevated. Phil, you can kind of chime that in. But yeah, so keeping that at a horizontal level, so where you're looking right into the middle or the top 1/3 of your screen. So yeah, that's very important as far as muscular tension, weakening of the muscle fibers, and strengthening. So Phil, do you want to chime in on that one?
Yeah, one thing I like to tell people is to set the monitor. There, I couldn't find the word. I was thinking screen monitor. Either way, screen or monitor. The very top of your monitor, so like the plastic outer edge of the monitor, even with your eyebrows, that is, or just above that, that is a good way to make sure that when you're looking, because if you set that at your eyebrow level and you look straight ahead, you're going to be looking at like the very top of your screen. But in order to look at the middle of your screen and most of what you're working on, you then have to look down just a little bit. Okay. So if it's up too high, if your screen's up too high, we're going to be doing a lot of this. which can cause a lot of pinching up here, which can cause some headaches. So if you're someone who gets headaches at the end of your day, that's something you want to look into a little bit. But if the top of the monitor is at about eyebrow level, in order for me to see the middle of my screen, I've got to look down just a little bit. And just that little bit of motion can open that area up a lot. Another great point, if anyone here uses bifocal or even transition lens glasses, but you really need the readers for your computer screen. We already talked about having the screen about an arm length away. And we were just talking about that head position when you're looking at your screen. I always have people who wear bifocals or transition lenses that need the reader portion to use their computer to get separate readers when they're on their computer at like a quarter of a prescription up. Okay. So if you need a 2.25, go to your local pharmacy and get a 2.5 reader. So it magnifies the screen just a little bit more. It's probably not enough to like make you dizzy or anything. And that way you can keep the screen. You don't have to keep inching yourself closer to the screen to try to see it. Okay. That's a real big take home. I find a lot of people that have to wear glasses, specifically bifocals and readers, have a big problem with that upper neck and headache pain. And it's probably due to trying to use their bifocals to see the screen. But if you have your whole your whole eye seeing all of that in better magnification, that's gonna help prevent a lot of stuff going on up here.
Absolutely. And then, some of this is going to depend on, like it says in the list, like the size of your monitor, the size of your screen, things like that. But as a general takeaway, keeping that at that eyebrow level is so important. I would say another one that's a little more important for me, for people, is the mouse. Is if you have an external mouse, is that mouse right near you, or are you reaching all the way over and doing a sort of lean and reach to kind of prop yourself up while you use that mouse? So by doing that, you can already see, like, I've had to come forward into my screen to be able to do that. I have my arm raised in this posture, which is also compressing the muscular system and as well the nervous system in this area because of the posturing that I have to maintain. And then if you think about that, even if you're maintaining that and you're taking your 30-minute breaks, you're still holding this one position for 30 minutes. So you can kind of think of it as, would you hold, if you had nothing to rest your arm on, would you hold it up for 30 minutes and be okay? And the answer is no.
No. So people have a hard time doing that for like 2 minutes, let alone 30. Yeah.
So the goal for that is bringing that slightly closer to you, closer to your keyboard, closer to your body, so that you can keep that at that 90-degree angle and not have to reach so far for it. So that would be one that would be a good one for me.
Definitely. Agreed.
Yeah. Awesome. Again, taking breaks every 30 minutes. I know that can be impossible sometimes when you guys are working from home and you're in these hour-long meetings that are happening. But even if there's a way during that meeting where instead of sitting down, you can gently move or stand up, sort of move the monitor, adjust yourself and take those breaks, just changing the story of what's happening in your room at that moment can really help your body's biomechanics, the tension in your system release, and just changing those. And it changes what muscles you're using. It changes how you're rotating your head. It changes the motion of the spine when you just take those breaks for yourself. So that would be another one that's huge for me, is if you can take breaks every 30 minutes, definitely do it. Try to really get it by 45 if you can.
Definitely. And one thing I'll do when I'm going to send out an email to everyone that registered with a little bit of extra information here and there related to what we go over today. And I'll put a link in there for the sit to stand transition desk that I use, because like I said, it's on Amazon. It's very inexpensive. And I've found it very, 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 very useful. The other big question I get with that, along with the whole taking breaks thing, is, should I just sit all morning and stand all afternoon? How should I do that? If you're taking breaks every 30 to 45 minutes, that's when you should switch your position. Okay. So if you have a sit to stand workstation, or it's something that you want to get after the workshop today, every time you go to take that break, when you come back to your desk, bring yourself up to standing, or vice versa, just so that you're getting more of that variety throughout your day. But good. I think we hit all the high notes here, didn't we?
Yeah. Yeah. I would say the only other thing is, because of the breaks, you're taking a break from the screen as well, if you can, for about 30 seconds to a minute, letting those eyes relax, letting that strain, because that strain, you're using those ocular muscles, and those are definite headache causers as well for a lot of my patients.
Yeah.
So they'll be like, I'm ergonomically set up, I'm doing all this stuff, but I'm not taking my breaks, and I'm still having these headaches that feel like they're right behind my eyes or right at the base of my skull. And
yeah,
that's when we can kind of chat and see, like, are you taking these breaks? Are you doing these things for yourself? So.
Right. I think the rule is, it's called the 20-20-20 rule. So every 20 minutes, look at something 20 feet away for 20 seconds. And that's a great
great little
rule.
takeaway.
Yeah. And even if you're doing it on the 30 minutes, but you're actually getting away from the screen, I think that's big. Oh, and it's got some of my laptop stuff down here too. That's right. So great. Awesome. So
awesome.
why don't we do this? What do you think, Dr. Andrea? Getting into a little bit of, I wanted to go over showing people a little bit of the sort of anatomy of things, and kind of explain why these areas can cause a little bit of this common pain and injury, both up into the head as well as down into the shoulder, arm, all that good stuff.
Yeah.
Great. So I'm going to share my screen with you all real quick here and show you a couple of different things. So what we are looking at here is the anatomy of the neck. Okay. If I can find it on my own screen here. I move some things around. Here we go. I found it. Okay. So we have 7 vertebrae in the neck here. Right in here is the joints of the spine, and each vertebra has a joint on each side, with the vertebra above it and below it. This is the back of your spine over here, where all the C1, 2, 3, 4, 5, 6, 7 is. And this is the front over here. And the purple is the discs. I'm sure everyone's heard of the discs of the spine. Those are a big topic of conversation. And then the little yellow things here are the nerves. Okay. So the neck should have a very slight sort of inward curve here. That has to do with both the bony anatomy and the ability for the muscles in this area to help hold ourselves upright with the weight of our head and neck. And some of those muscles actually flow all the way down to our low back. So if you've ever had a really, really tight low back, or some spasm in your low back, and you've looked down or moved your head real quickly and you don't move your torso, and you're wondering why it hurt your lower back, it's because they connect all the way up in the neck. So it is all connected. So this is the first area where the nerves have to run through, and all of these nerves here wind up somewhere down through our shoulder, or all the way down into our arm and hand. Okay. So this is sort of the first hurdle. So if we're changing the amount of stress, and most of the time, and Dr. Andrea, if you see anything else, please chime in here, but most of the time it's right in here, where a lot of this here and up here, right? So right at the base of the skull, that's where the nerves come out that go to our head, that can cause headaches. That's why doing stuff like this can cause pain up into the head. But doing stuff like that also makes this area work a little bit more and take a little bit more of the force, and that can cause a lot of the symptoms we see. So this area here and this area here are probably the 2 biggest culprits in the neck, as far as creating pain locally here in the head and neck, but also down the arm. Okay. Let me share another thing with you here. So after those nerves leave the neck, they go through what is called the thoracic outlet. Okay. So again, I've got to pull that up in my, oops. I thought I had it up here. Bear with me here. Sorry about that. Here it is. So you could all see it, but I couldn't. The thoracic outlet here. So after they leave the neck, they go through a couple muscles here called the scalenes. These are the nerves, these yellow things here. And you also have some arteries and veins, which we'll talk about real quick here too. They go through these scalenes. They go over your first rib, which is right here. They go under your pec minor muscle. So this isn't your big pec muscle. It's a smaller pec muscle underneath that connects to your ribs. And then they go down, and they wind up going all the way down into your hand. Okay. That's where those nerves all wind up, is down in different places in your in your hand. And then even further down from the thoracic outlet, there are areas around the elbow and then in the wrist that are other channels for those nerves to travel through. Okay. So the reason why that's important is because anywhere along the line of those nerves is a potential compression point or irritation point of those nerves. And once one area flares them up, any one of those other areas could be a secondary site of flare up. Okay. So if up here in the neck, we have a lot of hinging going on because we're doing one of these things, the little chicken neck here, or pecking like a chicken while we're working on the computer, you can have some irritation of one of those nerves at its nerve root up here around that C5 area that we talked about. But if you have really tight pecs because you're rounded forward and really tight scalenes because your head and neck is forward, those could also be areas that are affecting it as well. And in that C5, C6 area, guess where some of the symptoms could wind up? Down here in these couple of fingers, which is also where carpal tunnel symptoms tend to wind up, which is why people think they have carpal tunnel when the problem is actually in their neck or their pec or somewhere up there. Okay. So it's all very interconnected. And that's why the variety of the system is even more important than the ergonomic setup. So, and even your posture, right? The variety and getting yourself out of those sustained stressful positions is so important because of how complex that system is from the neck all the way down to the hand. Anything else to add there, Dr. Andrea?
Nope, I would fully agree with you that it's that that forward head posture is something like we as chiropractors really focus on, because what happens over time with too much forward head posture, and I could go way back into the developmental of that, but we start to lose that secondary curve that we've made in our neck. So where our neck should be slightly curved, if the more forward head posture that we start to have, and here Dr. Phil will give us a great thing, we start to lose that cervical curve and it becomes more straight. So the straighter that curve becomes, or if it goes into a reverse, which we're seeing a lot more of in the last 5 to 6 years, is a loss of that cervical curve. And when you lose that curve, or it becomes more straight, more of what we used to call a military neck, is you have more pressure coming down into the spinal canal. So that means the discs, which are your nice, amazing, wonderful shock absorbers for the spine, they help that cushion, they help the bones not touch each other, all that good stuff. What happens with that forward head posture is we get a shearing of the joints. And with that, we start to sometimes see degeneration in the spine in younger and younger people lately. So that's why we always, when people talk about text neck, or I'm sure there's so many other different phrases for it now, but it's really important because we don't want to lose that beautiful cervical curve that we worked on since we were babies, since we were learning how to crawl. We want to keep that nice cervical curve so that the amount of pressure that our head is carrying can support, so our neck can support that, which is decreasing tension, and in turn, hopefully decreasing any degenerative process that you may have. So this is a great visual on what can happen with every degree that you start coming forward. You're putting 5 pounds, up to 5 pounds of added pressure onto the spine, neck, shoulders, and then the spine is a connected unit. So what goes up on above affects what goes down below eventually. Yeah. So this is a great visual, Phil, if you want to chime in on that.
Yeah, no, I think that I think you kind of hit the nail on the head there. And this brings me to another point that I wind up going through with a lot of clients that I work with is they might have something happen. Actually, I'm working with someone right now who actually got a muscle spasm in her mid back and over to her ribs while riding a horse. Okay. But it wasn't really clearing up because of a lot of the things we're talking about right now. Some of her postural positioning at work and some of those things even before the injury, but then also during the injury wasn't allowing some of those areas to calm down. Okay. Because we were always using her arms and shoulders in positions and her head and neck in positions that put more stress on that area. And as the day went on, it was just like, it doesn't hurt that bad, but I'm so frustrated with how fatigued and how difficult it is to just keep going because it's spazzing more, feeling super fatigued and just annoying. And And that is really because of, again, probably decades of some of those postural adaptations that aren't great for that area, put stress on an area that's now injured and not working well, and not allowing it to clear up. So, you know, a lot of people, and you all might identify with this too. You might have had something that's sort of that's nagging, that comes and goes, comes and goes, comes and goes, and eventually it comes and it just stays, and it doesn't and it doesn't go. And you're like, geez, this is usually something that clears up. But over years and years, maybe even multiple decades of your body adapting to the way that you tend to use it all of the time, which might be in some of these positions that we've gone over today, it doesn't allow that area to calm down because there's so much uneven stress being placed on that particular area that it doesn't have the time to calm down and take the stress off those nerves or whatever the case might be to actually get you past that point. So
yeah, because if we don't change anything going on in our bodies for 5-10 years, I mean, if we go from being a student to being a desk worker to working from home, like those are all the same positions constantly.
Yeah.
And if we don't come out of those and go the other way,
right,
then those postural adaptations, while they support us in the short term, in the long term can cause problems. And like you said, I don't know how many people I see in the office were like, well, I had this happen 5 years ago and I fixed it, and why is it coming back?
Yeah.
And it's like, well, what has changed in your life? Nothing. That's the problem.
Right.
Nothing changed in those 5 years. You had the same job, no change in setup, no change in physical activity, no change in diet and exercise. So we can't ask our body to do something that we don't give it the information to do. So
100%. Yeah, I fully agree. So I want to give you all just a couple of quick things, kind of like quick, easy, bang for your buck things that you can do during your day, during some of those breaks you take, that'll get you out of some of those stressful positions. Okay. So I call it micro stretching. So I'm going to show you 4 of them because they're the 4 quickest and easiest to do. And the idea behind micro stretching is not to actually improve flexibility, because we're not holding the stretch long enough to change the tension in the tissue that we're stretching. But what it does is it kind of wakes that area up a little bit. It sends a message and signal to the muscle, from the nerve to the muscle, to kind of wake it up and reset it a little bit. It's going to increase a little bit of blood flow to the area. And again, it's just going to feel good because it's going to get you out of some stressful positions that we often tend to get in when we work in the same position for long periods of time throughout your day. Okay, so we're going to focus on 4 muscles. The first one is called your upper trap, which is the big bulkier muscle up here on the top of the shoulder. So to stretch that, all you do is, I usually have people take the hand on the side we're stretching and grab the chair you're sitting in, or you can even just put your hand behind your back and you just gently tilt your head away. Okay, just like that. And I want you to stop when you start to feel a stretch out here. Okay, don't go until the stretch is super intense, because that can actually make it rebound a little bit and spasm up more, and we don't want that. Okay, it's just a nice, comfortable stretch. You hold it for 10 seconds, just 10 seconds, and then you switch sides and do the same thing on the other side. 10 seconds. Okay. The next muscle we're going to stretch is called your levator scapula, which runs from the top of your shoulder blade up to your neck here, kind of runs up like this. Same exact position as before, but as you tilt to the side, you're going to look towards your opposite armpit. Okay. And you're going to feel that much more down this way. Okay. Same thing. Stop when you start to feel a stretch. You're only holding it for 10 seconds. And then you're going to switch sides. So you tilt and you look down towards your opposite armpit. Okay.
And I think it's really important that it's not always the more the better with the stretch. It's not always the more you push it, the better the stretch is going to be. That can sometimes be the exact opposite. So when Phil says, just go to the point where you start to feel the stretch and let it hang there, that will allow you for so much more opening, so much more option and opportunity. And over time, that will build and build where you can get a deeper and deeper stretch. But don't go for that really deep stretch right away.
Definitely. Yes. Especially if it is feeling really tight. The worst thing you can do is crank on it. Okay. The next two are actually for the wrist. Okay. So we're going to stretch this area of our wrist. So to do that, we straighten out the elbow, palm up, and you're going to use your other hand to bring your fingers down toward the floor. Okay. Really important that your elbow stays straight the whole time. Only bring your fingers down until you start to feel the stretch. Okay. Just like the stuff up in the neck. Same thing. You're going to hold for 10 seconds and switch sides. Okay. And then the next thing we're going to do is stretch this area up here. Okay. So this is the muscle group that is responsible for tennis elbow. Okay. Lateral epicondylitis. So this is a good one to stretch. What you want to do is make a fist with your thumb inside your fist and then bring your wrist down and slightly out towards your pinky. Okay. And what I want you all to do is bring it straight down first and see how that feels. And then see what happens when you just go a little bit out towards the pinky. Just that little bit centers that stretch just a little bit better through that muscle group. Okay. Same thing. Don't crank on it. Hold for 10 seconds, switch sides. Okay. So that micro stretching philosophy, I tell people, do those micro stretches, 10 seconds on each side, every 1 to 2 hours during your day. Okay. Doing all of that is going to take you less than 2 minutes, right? It's like a minute and a half at the most every couple of hours. And it's just going to help make those areas feel a little bit better. Okay. Now, 2 to 3 times during your day, if those areas are really, really tight for you, you can actually hold all of those for 3 rounds of 30 seconds. Okay. To actually build flexibility in those tissues. Okay. But for the micro stretch, you really only want to do the 10-second bouts. Okay. But yeah, if those areas are really, really, and if you're doing these for 10 seconds, you're like, oh man, that feels really good. A couple of times during your day, hold them longer and do multiple bouts on each side, more of that like 3 rounds of 30 seconds. And that'll actually help you build flexibility. Awesome. Anything else to add there, Dr. Andrea, before we do the Q&A?
No, the only other couple of kind of not random, but things I noticed with people who are working from home or working at a desk consistently. One, proper hydration. If you are not getting properly hydrated while you are sitting at that desk all day long, that again is your muscles will go into spasm much easier. They'll go into contraction much easier, stiffness into the joint space, disc not being hydrated, all that good stuff. And it helps promote proper organ function and digestion and all that good stuff. So along with the stretching, when you're doing those exercises and you're like, you know what, let me check in. Have I had a glass of water, or have I had a really healthy electrolyte balancing drink in the last 3 hours? And the answer is no, then you need to go grab yourself something to drink.
Yes.
Don't skimp on that. That is so, so important. I see not a lot, but quite a few problems that I see with people coming in is that they're just on this chronic low level of dehydration all day long because they haven't moved from their desk. Even when working from home, when you have a little more access to that hydration, we just get so enveloped in that project. So hydration and the stretching that Phil just showed you can change some things. And then the only other thing I would say is if you are having some sort of issue, be it neck, shoulder, low back, that kind of thing. I know Phil and I actually talked about this the other day, that we generally, rule of thumb is between like 5 to 7 days if that issue hasn't cleared itself up, because a lot of the times our body will just feel sore or feel achy or something will happen and it clears up. Within 5 to 7 days, if that issue hasn't cleared up, we would recommend you seeking out your healthcare provider, your chiropractor, your PT, or the healthcare provider that you trust with your health. So
yeah, definitely. Yeah, agree with all that. Great. So if anybody has any specific questions, please, you can either throw them in the chat real quick, or if you want to unmute yourself and ask your question, you certainly can do that too. We've got about 7 minutes here for some Q&A. So any questions you have, please throw them in the chat. And while you're doing that, I do have, I just wanted to share my contact information with you all real quick. So if you want to take a little, screenshot of that or jot that down, you certainly can. And Dr. Andrea, if you have something like this, I can always allow you to share your screen, or
I'm going to put it right into the chat here.
Pop it in the chat. Perfect.
Yeah.
That works too. So you all have our contact information. If you have any more questions that pop up later, or you want to reach out to us for any reason. Fantastic. So any questions at all, please pop them in the chat or unmute yourself and you can ask. Okay, question here. I had an issue with my back, which didn't clear up. So I had an MRI and it showed 2 slip discs and a fractured T8. Okay. Yeah. So actually, Dr. Andrea and I were talking about this the other day too. Any structures are moving for this. So without an exam, especially with a fracture, I'm not going to recommend anything on this workshop for you, because without an exam, I especially if that fracture isn't healed, we don't want to stretch anything that is fractured. The other thing is if I had to guess, depending on where your back pain is located, the fracture was probably causing more of your pain than the discs were. Again, Dr. Andrea and I just talked about this MRI stuff the other day. In about anywhere from 40 to 60% of people, that varies based on age, disc bulges or disc degeneration will show up on an MRI in about 40 to 60% of people with no pain whatsoever. Okay. So unless that image, what we see on that image matches up with what you, the patient, are telling us and with what we're finding in our physical exam, it might not be something of a whole lot of importance. He said in the process of healing, fractures and pain, the fracture in the mid back, disc in the lower back. Yeah. So, you're actually a perfect example. Okay. You have disc bulges in your low back, but you're not having any low back pain. Your pain is all in the mid back with that fracture. Once that fracture is fully healed, there are certainly things you can do to help with any lingering pain, and there's some prevention that you have going on. So certainly can reach out to, a PT or someone that chiropractor, someone that you, like Dr. Andrew said, something that you trust with your care, and can certainly improve that. But
I can also say, depending on the fracture in the thoracic spine, depending on what kind of fracture that is.
Yes.
Is it a compression fracture? Is it a pars? There's different fractures that warrant different treatments and different things to look at.
Right.
So that's definitely something about finding out where the fracture is, if they've already told you, or if you have that report. And then going from there. I'm glad that you're in the healing process, though.
Thank you. Can I? I've just taken myself off mute. Thank you so much for this. So, I had some physio before realizing it was a fracture. You know what you said earlier, doctor, about if you've got a back problem or some sort of problem and it hasn't gone away, then go and see a consultant. Mine didn't go away for 2 weeks, but I had physio in that time. And then I had the MRI, and after physio, I couldn't move. So then I had the MRI, and then I got told it was a thoracic fracture. So I've just decided to let it heal over time. It's not 100% better. It's getting better. But I just, I don't know. It doesn't matter who I ask about this. Like, do fractures heal of their own accord? How long does it take? Things like this, because the alternative is surgery, which I don't want to have. So it is a compression fracture. They've done a DEXA scan recently to see bone density and things like that. Bone density is a little bit low, admittedly, but I do think this workshop has been instrumental, because I do believe that over a period of years of using just desk bad posture, because if I'm not driving, I'm flying. If I'm not flying, I'm sitting. If I'm not sitting after work, I'm sitting on a couch, so the posture is awful all the way through. And I do believe that as a result of it, the muscles in the back, the core, everything is weakened and it's not given the support. So I'm in the healing process, and I accept that you can't probably, without knowing much more, give me any exercises or stretches to do. But is this something that does generally heal for people on its own accord, and it's fine, or?
So I've seen people heal. I've seen people not heal. So I'm sure Phil can say the same thing. Compression fractures are, I don't want to say common, but they're not uncommon to have happen, especially when you have a little bit of bone density loss, especially in that thoracic spine, or you've had a compressive force that you might not have even been aware of, like jumping on a trampoline, doing a hard hit class, falling. Some people have fallen and not known that fracture happened. So that compressive force led to those issues. And then it's kind of like building a house on a bad foundation. So what came first? Was it the compression fracture or was it the disc? And where do you start? Compression fractures, once they're there, they heal to a point. And Phil, you can probably chime in on this a little bit more. They heal to a point, but generally there's loss of that vertebral height permanently. So that doesn't mean your pain is permanent though.
Right.
So I would recommend looking if there's somebody in your area that is an incredible chiropractor that works with stuff like this, or a physio PT like Dr. Phil, who works with functional movement and working within that system, working with those injuries on a functional movement basis.
Yeah.
Phil?
Yeah, I think, to answer your first question, stabilizing that area. So I don't know if you're using a brace or like a TLSO brace or something like that right now. Usually that's what I see people prescribed when they have a compression fracture that's sort of what we'd call idiopathic. We don't really know where it directly came from, but the combination of stabilizing that area and time is the only thing that's going to tell us if it's going to heal on its own without surgery. The good news is a lot of the surgeries they do for that nowadays are very minimally invasive, and they just go in and expand that area and give it some support with like basically some cement and fix that wedge a little bit, let that heal up over some more time and in some bracing. But after that, whether it does heal for you conservatively or with a procedure, it's going to be real important that you work on a lot of that, like what Dr. Andrea said, that functional movement. Okay. Yes, certainly some hands-on work. And like she said, working some areas above and below that, maybe with some of the things that a chiropractor can do, combining that with some hands-on work that a PT can do, but improving some functional movement through your core and through your hips is going to be very crucial to fix the pain. Because even when we fix things like a compression fracture, some of the pain in that area might be from just some undue stress on some nerves due to compensation that have developed over the time of healing. And you're really going to need to get that area stronger. So I guess I would say regardless of how that area heals, it's going to be real important for you to get some care afterwards to help with any residual pain and make sure that we're preventing any of those other areas in your spine from having pain as well.
Thank you.
You're very welcome.
Of course. I'm so sorry you're going through all of that.
Yeah, hopefully that heals up well for you and you don't have to go the surgery route.
Yes.
Thank you both so much. It is healing.
Yeah, lots of options before surgery.
Yes. So. Yeah. For sure. Awesome. Any other questions before we wrap up for the day?
We had one about the footrest and how high it should be. I wrote footrest should be high enough that your feet can touch it. Same thing. You want to be able to touch that footrest too, but not so high that your knees are up into your chest. So you want to kind of keep them at that 90-degree angle. Make sure that it's always good is the hips and knees are in the same angle together, so that one's not higher than the other, one's not lower than the other. So maintaining that sort of posture is what you want to be cognizant of.
And that's another thing you can play around with a little bit. I think if your knees are a smidge higher than your hips for a little bit or a smidge lower, some of those footrests you can actually adjust a little bit. So you can play around with that. But yeah, you want to, you don't want to be too high or too low, right? there's probably 5 to 10 degrees of variance there. That's sort of acceptable, I would say. But yeah. Great.
So awesome. Move the body, move it or
body.
lose it is the term that has been around for years. It's true. Move it, move the body. So after a long day of working, get away from the desk. Don't go from your desk. Like Kay just mentioned, it was a great point to bring up. Don't go from your desk or your plane or wherever you are and go to your couch.
Right.
It's the same thing. You're doing the same motion. And then you go to lay down in your bed.
Right.
Or you fall asleep on the couch. So movement, water, and those amazing stretches that Dr. Phil showed, I think will help out a little bit. And you have all of our contact information if you guys need to reach out with any other questions.
Yes, please don't be afraid to reach out with any further questions. And within the next couple of days here, I'll be sending out just sort of a wrap-up email, a little more information for you all, and where any of you can find the replay of this. So if you want to go back through and watch any of it or listen to it again, you will have all of that information. So if there are no further questions here, you all are free to go. We'll wrap up with that. And we can't thank you enough for joining us here this morning.
Yep. Awesome. And when you're reaching out, if you're looking for a practitioner in your area to help you with some of this, and we possibly might know somebody in your area, again, put that into your question and we might be able to refer you to somebody you need help.
Yes,
all right?
Definitely. Thank you, everybody.
Thank you.
Thank you. Have a great day.